Hello, scholars. My name is Dr. Karis Dillon, and the goal of this channel is to make academic subjects easier to understand. If you haven't already done so, please click that subscribe button and like button so I can continue to make videos. Now, in our last video, we covered specific phobias, and in this video, we're going to cover social anxiety disorder. So let's begin. Have you ever been to a concert, a protest, or just a classroom lecture and you were bothered by the amount of people in the room? Did you worry that you're going to be stared at? Did you worry that you might be called on or the focus of the room might suddenly be on you? Did you ever worry about tripping or falling and people laughing? Maybe you felt like you couldn't breathe and your heart rate went up. These symptoms are all normal, but they could be part of something called social anxiety. Let's go over the symptoms of social anxiety disorder, which are found in the DSM-5. So the first symptom of social anxiety disorder is A, the individual has anxiety or fear about a social situation in which the people involved might criticize or scrutinize them. This can be as small as a conversation with others, having a meal in front of others, or having to perform some way in front of people, such as public speaking. B, the individual has fear or anxiety over doing something to bring embarrassment upon themselves, or they're afraid people will see their anxiety and this may end up in rejection from others. C, the issue with seeing or being around others will always create a situation where the individual has fear or anxiety. D, the individual will do everything they can to stay out of the situation or not attend. E, the individual has fear or anxiety about social situations, but this fear is not logical or rational given the actual situation. F, the individual that fears anxiety or fear will try to avoid social situations for more than 6 months. G, this avoidance or anxiety will cause distress with the individual with relationships, with their work, or with other facets of their life. H, this anxiety the person feels is not present because of a drug they took or another medical condition. I, the fear or avoidance techniques are not present because of another mental condition such as autism spectrum disorder, body dysmorphic disorder, or panic disorder. J, if the individual has another medical condition, obesity, injury to different parts of the body, or Parkinson's disease, their avoidance or anxiety is excessive or not related to various situations. There are a lot of individuals that have performance fears. This can mean a person who is a dancer, a singer, an athlete, or a public speaker can have severe anxiety or fear about performing in public, which can hurt their professional life. These fears can also take place in school, work, or in other social situations where these individuals are asked to perform. Performance social anxiety is present only in performance activities and does not seem to exist in other social situations. What most people with social anxiety fear is being ridiculed by others and told they're crazy, boring, dumb, intimidating, unlikable, etc. They can also fear their face turning red from embarrassment, feel like they're sweating too much. They may fear they're staring too much, stumbling over their words, have anxiety about offending others, pointing at someone, shaking hands, farting in public, intimate topics, etc. For someone that only gets fear or anxiety only at certain times in certain social situations, this would not be considered social anxiety disorder. For children, remember that anxiety usually looks different in children than adults. They may have temper tantrums, try to hide, cry, or cling to those that they are close to. For someone with social anxiety, the fear and anxiety must create problems within their normal routine in life. It also needs to cause significant distress in the person's life, including schooling, work, or in social relationships. If a person gets passed over for a promotion at work or refuses to speak publicly in class, this would be considered social anxiety disorder. You might be wondering what a person with social anxiety looks like. It is strange, but an individual might be highly controlling of their conversation, or they can be submissive and less assertive. Their voice may be soft and their posture rigid. These persons might appear shy and don't really talk about themselves much. Individuals with this disorder may attempt to get jobs where they don't have to interact with people on a regular basis. They may also live at home for a longer period of time. Women with the disorder may choose to be homemakers or stay-at-home moms, whereas men with the disorder tend to marry at a later age. Self-medication with both is also common. 7% of the U.S. population is diagnosed with social anxiety disorder each year. In Europe, that percentage is 2.3%. Children tend to have the same percentages as adults. Females are seen with the disorder more often than males are. The average age of diagnosis is 13 years old. 75% of individuals diagnosed with the disorder are 8 to 15 years old when they are first given their diagnosis. The disorder can come on suddenly or it can come on slowly. If a child is treated negatively within their childhood, this can be a risk for later developing social anxiety disorder. Behavioral inhibition at an early age also tends to put children at a high risk for social anxiety disorder. There's a large genetic role in this disorder as first-degree relatives increase the risk of developing social anxiety disorder. Women with social anxiety disorder tend to have the most fears and often have other disorders like depression, other anxiety disorders, and bipolar disorder. Men tend to have more substance use disorder. Those with social anxiety also tend to drop out of school at higher rates. They tend to have a decreased well-being in life, less of a quality of life, have a lower SES, which means socioeconomic status, tend to be unmarried or divorced, and usually do not have children. Leisure activities tend to be impeded as well. About half of individuals seek treatment for social anxiety disorder in the U.S. Some experience symptoms for 15 to 20 years before they seek treatment. Okay, well that is the end of the video concerning social anxiety disorder. This is a very common disorder, so if you're here learning about it, just know that you are not alone in this, and there are many people out there that have it. Even if they don't quite have the disorder, they could definitely have symptoms of it, and we treat it the same way, usually with cognitive behavioral therapy or other types of therapies that professionals like to use because they work. What works with one therapist might not necessarily work with other therapists. So I just want to thank you so much for being a part of this channel. You guys are amazing. You make this work a lot easier to do. So I hope you enjoy the videos. I hope you have an amazing day, and I will talk with you soon.